Now, healthcare experts are investigating if a rare illness in young children is associated with COVID-19. Nearly 100 children and teenagers across the nation have developed symptoms similar to Kawasaki disease. We asked Dr. Lance Slade, a Macon pediatrician, to explain what symptoms you should look out for, how it ties to coronavirus, and how it's treated.
It's a clinically diagnosed syndrome where you have a fever of 5 days or more, and then you have 4 of 5 or more symptoms, which would be like on top of the fever, you can have the strawberry tongue, non-purulent conjunctivitis or pink eye. You can get a rash in your hands and possibly one swelling. Certain kids in rare instances are showing up like Kawasaki syndrome, but with COVID being the likely source. So it's rare, but it is happening, where they're having these elevated inflammatory markers, either your CRP, C-reactive protein, we call it cedrate, or their white count can be elevated. And then they're having this like multi-system inflammatory inflammation. So they're going to be in the hospital. They're going to get some immunoglobulin therapy. Cardiologist is going to check their heart, do an ultrasound or echocardiogram. And then they're going to be put on low-dose aspirin and followed clinically to make sure they don't have any coronary artery inflammation long term, and then clinically they usually get better. So in this case, it's still so fresh for us. I think they're treating it very similarly in the ICUs as they try and track it as well.
Beverly Knight Olson Children's Hospital at Navicent is the major children's hospital for the southern half of the state. They say they've seen no Kawasaki-like symptoms here so far.